So a lot of people will ask, what is an EMDR session like? Because it sounds kind of weird. You use gadgets and you can do, it's not just talk therapy. What is it? So first, there's always an assessment phase, just like with any other therapy, and you're trying to figure out what's the problem, what are the negative beliefs around these events that have occurred. For example, with childhood or complex trauma, some of the most common ones are I'm bad, I did something wrong, I'm not good enough, that kind of thing. And so looking at those things that you want to change, or maybe some of the emotional reactivity around a certain situation. And we call those events targets. And so once you've picked your target, a therapist will ask a certain set of questions that get to the thoughts, images, emotions, and body sensations. Then you'll use BLS, the bilateral stimulation, and I usually use the tappers, or sometimes kids will call them the buzzies, those pulses in your hands. The client will hold those for 20 to 30 seconds, and they're quiet, and they're kind of thinking and recalling the event and all the aspects of the event. And then I'll just ask them, what'd you notice? And they'll tell me, they'll kind of report back on their experience. So we'll go through a session like that. Sessions are usually 60 to 90 minutes. And by the end of a session, often people are experiencing less disturbing thoughts, images, body sensations, and images. The memory seems less painful. They feel their self-esteem usually goes up. They feel more capable, able to handle themselves in a similar situation, or if they're reminded of that situation again, we see behaviors change. It's a great thing to witness